a 3-year multi-million rand public health enhancement fund, which heralds groundbreaking collaboration between the public and private health sector in South Africa, is expected to inject millions to assist the government to meet its obligations, enabling them to expand its intake of medical students, build additional capacity in the management of TB, HIV and AIDS. Now, to unpack this, I am joined in the studio by the Director General in the Department of Health, Precious Matsoso, and of course Stavros Nicolaou, who's the Senior Executive at Aspen Pharmacare. Thank you so much for joining us. DG, let's start with you. Groundbreaking agreements, traditionally public and private healthcare are often at odds with each other. Are you satisfied that you are beginning to strike a new path with the private healthcare industry?
Well, indeed. Thank you so much for inviting and to your viewers. This is groundbreaking in a sense that I think what we've seen over the years has been this conflicting and adversarial relationship that we've had, and some has been quite fierce. I mean, we've been in courts over the years, but we also recognize that for South Africa as a country to respond to the HIV/AIDS burden of disease, we can only do it if there's partnership. And this started with the minister taking leadership to invite different partners, private sector, development partners, civil society, to get South Africans to test. And we were able to test 20 million people over a 20-month period. But with the announcement of implementation of national health insurance, we've also recognized that the only way we can succeed is when we have a capable workforce and good management of our facilities. And we have been in discussion with the private sector as to how we can partner in these particular areas. Our view is that the health workforce is not confined to the public sector. When our academic institutions produce doctors, produce pharmacists, nurses, they don't just produce them for the public sector.
Let me bring in Stavros here. The health department has made very clear its developmental objectives. It's often been at odds with the private sector around, what you bring to the party. How would you describe this partnership, and how does it benefit the private sector?
Look, I think, Karema, firstly, thanks for the invitation to be on this program. I think there are two areas here. The first is that there's a realization across society, not just in the public and the private sectors, that we're under-resourced in healthcare. And if the private sector sits back and doesn't become involved, we're certainly on a course of calamity here. So I think there's that realization, and we discussed this amongst ourselves in the private sector. We engaged with the DG, with the minister, and we realized that we've got to start building bridges between the private and the public sector. And we've got to start working together on projects. Now, there's no better way to move on to the second thing of working together and building confidence than if you set up a fund where people are actually contributing to a fund, and they've got a vested interest because they've got to make sure they're getting delivery and a return on that investment. So I think those are the two aspects: building bridges on the one hand, working together, and on the other hand, getting involved in projects and initiatives that are going to deliver better outcomes in healthcare in our country.
DG, let me bring you in here. Quantify for us in financial terms what the, this partnership is going to cost, and where, who's going to bring what portion of the money to the table.
Well, so far, there are 23 companies that have signed up to the social compact. There are three key areas that have been identified where this partnership is going to be an area of focus. The first is the increase in the intake of medical students. That would be our first focus, because we need more doctors in South Africa. The second, of course, over the years will increase other occupational categories, pharmacists and physiotherapists and so on. The second is the training. We just launched an academy of health leadership and management. We recognize that the capacity of our CEOs in hospitals and managers in general including managers in districts where we are piloting NHI, it's fairly weak, and we wanted to partner in ensuring that we've got capable CEOs who can run our institutions in preparation for NHI. The third area is that South Africa has a high burden of HIV and TB, and there's no reason why we cannot be world leaders in the development of medicines, of diagnostics, and in investment in research and development. And for us to do that, you have to invest in producing PhDs, masters, and doctoral graduates, as well as postdoctoral candidates. So we've identified these specific areas. So the initial funding is about 40 million. 20 million will go to undergraduate training to increase our student intake. The second area, which is for the academy, will be 10 million, and the remaining will be 10 million for R&D, but in particular for the PhD production. We're hoping, and I think it's a little bit ambitious, that in the next 10 years we'll probably have 1,000 PhDs.
Well, that's certainly very ambitious. Stavros, the money that's, or rather the figures that's been bandied about, what proportion of that money, is there clarity on what the private sector will bring to the party? How is that finance going to be organized? And more importantly, is the private sector convinced that it will get value for its money, particularly if one looks at some of the deficits in the state's ability to often roll out expenditure?
Look, Karema, I think all the questions that you raised are precisely the questions that the private sector raised when we were in discussions with the Minister and the DG. And I think quite simply how it's going to work is there's going to be a fund set up which will be administered by the private sector, or at least the 23 contributing companies, and whoever else comes on board afterwards.
So that's actually going to be run by you guys?
Correct.
Okay.
Correct. It's a 3-year fixed term commitment that could be renewable after 3 years, and it's a fixed percentage contribution from each of the participating companies that will take place. So once the funds are collected, they'll get paid directly, for example, to a teaching institution, whether it's a university or where there's going to be PhD graduates.
So all the middle people are going to be cut out.
So we're going to be, the transacting will be done directly between the fund and the institution.